Americans should know that this is a potentially very serious public health threat. But at this point, Americans should not worry for their own safety. This is a very fast-moving, constantly changing situation. Dr. Redfield and Dr. Fauci will walk through some more details of the current situation and response. Part of the risk we face right now is that we don't yet know everything we need to know about this virus. But I want to emphasize, that does not prevent us from preparing and responding. We have the experience of responding to two earlier coronaviruses that emerged to cause serious illness in people, SARS and MERS. And we have experience responding to bird flu outbreaks in Asia. One challenge is that with an emerging virus like this, our current assessments are based on an uncertain denominator. Our denominator is the 4,500 plus cases that have been identified in China, as well as more than 60 cases in other countries. But these early cases are naturally the most severe cases because patients presented themselves to healthcare providers. How does this skew our understanding of the virus? First, we're still determining the real speed of spread of this disease, which is represented by a number known as R0, which is the average number of additional people infected by a given person with the disease. One paper found R0 estimates for this virus ranging from 1.5 to 3.5, as compared with, say, a number of 12 to 18 for measles. We're also still learning about the severity of the virus. Currently, China is reporting more than 100 deaths from the more than 4,500 cases. That is a high rate. But again, the cases that have been identified skew to the severe, including patients who are older or have other illnesses. The mortality rate may drop over time as we identify a broader set of cases. We're also working to understand the incubation period. This number varies for coronaviruses, with extremes being anywhere from 2 to 14 days. That number could be higher or lower for this virus. Finally, we're working to determine whether there is asymptomatic transmission. Normally with a coronavirus, we see more viral shedding and more transmission when a person is more symptomatic. China has reported there may be evidence of asymptomatic transmission. All of these questions must and will be answered in order to provide a proper risk assessment. But they are not stopping us from focusing on applying tried and true public health methods in the meantime. The playbook for responding to an infectious disease outbreak is relatively simple and multi-tiered. You identify cases, isolate people, diagnose them, and treat them. Then you track down all of the contacts of the infected person, and you do the same with those people and the same with contacts of contacts if necessary. That approach is how public health departments and healthcare providers, working with the CDC, are handling the cases here in the United States. And I am very grateful for the hard work that they are all doing together. This kind of work, coupled with studies and analysis, is also how we answer the questions I described earlier. On January the 6th, we offered to send a CDC team to China that could assist with these public health efforts. I reiterated that offer when I spoke to China's Minister of Health on Monday, and it was reiterated again via the World Health Organization's leadership today in Beijing. We are urging China. More cooperation and transparency are the most important steps you can take toward a more effective response. Beyond that, all options for dealing with infectious disease spread have to be on the table, including travel restrictions. But diseases are not terribly good at respecting borders. So we would have to assess carefully whether the evidence recommends any steps beyond the thoroughly tested methods I just described. I know this playbook well because I was in the same building here in the 2000s, serving as general counsel and then as deputy secretary alongside some of these very same fine scientists and public health officials when we responded to the SARS outbreak, monkeypox, anthrax attacks, pandemic flu preparedness, and a number of other infectious threats. That has given me a deep appreciation for the institutions that oversee our response. The United States has the world's finest public health system. We've been monitoring this virus and preparing a response since back in December. But it's more than that. Preparing for these kinds of outbreaks is part of the daily life at HHS and for America's public health professionals. Preparedness is a day job around here. We are constantly making investments, training personnel at all levels, carrying out simulations and exercises, and sharing information. This commitment goes straight to the top. The President and I have been speaking regularly about this outbreak, and I have been speaking with the senior officials at HHS and the White House multiple times each day since the outbreak began to represent an international threat. The President is highly engaged in this response and closely monitoring the work we're doing to keep Americans safe. I'll give you a brief sense of the work being done across HHS beyond the CDC activities that I've mentioned. Our emergency response arm, the Assistant Secretary for Preparedness and Response, or ASPR, is assessing the level of preparedness we have with the Strategic National Stockpile, which includes pharmaceuticals and other necessary medical supplies. HHS's Administration for Children and Families is working with the State Department to assist any Americans who will need assistance being repatriated to the United States. NIH, ASPR, and FDA are pursuing research into and assessing the possibilities for vaccines, diagnostics, and therapeutics, which is necessarily a longer-term project. In addition to the work being done in government, there are basic precautions all Americans can take. Healthcare providers should be on the lookout for patients with travel history to China, especially Hubei province, and for relevant symptoms. Late on Monday, the CDC and the State Department issued a Level 3 travel advisory for all of China. This higher level of alert means that Americans should reconsider or postpone travel to any part of China. The State Department has also maintained what they call a Level 4 warning for Hubei, meaning Americans should not travel there. In closing, I'll remind the American people one more time. We are working hard to keep you safe. We are constantly preparing for the possibility that the situation could worsen, and your health and safety has been and will be our top priority. To discuss more about the current state of the epidemiology and CDC's work, I will now hand things over to CDC's Director, Dr. Robert Redfield. Thank you.
Thank you, Mr. Secretary, and thank all of you for joining us here today as we discuss the latest developments that are involved in this situation. It is a rapidly changing situation in the United States and throughout the global community. Right now, we know of 18 international locations that have identified cases of this new virus, including the United States. To better protect the health of the American public during the emergence of this novel coronavirus, and based on the evolving information from China, CDC has reassessed its entry strategy and decided to expand to screening travelers from the 5 airports originally to 20 airports in the United States. My thoughts and prayers are with all the healthcare providers and frontline responders that are handling this public health threat, as well as the people of China. I know that many Americans may be worried about the virus, and I wanted to let them know a few things that they can do. Everyone has a role to play in helping contain the spread of this virus. CDC, in conjunction with the State Department, has updated our travel guidance and now recommends that travelers avoid unnecessary travel to China. It's currently the flu season and respiratory disease season, and there's a lot of respiratory disease out in our nation. We recommend washing of the hands, covering your mouth when you cough, staying at home if you're sick. For healthcare providers, we ask them to be on the lookout for people with a travel history from China, especially Hubei province, if they develop fever and respiratory symptoms. And if you're a healthcare provider that's caring for a confirmed patient, we ask you to follow the recommended infection control procedures. For all people that may have this infection, we ask you to follow the CDC guidance on how to reduce the risk of spreading your illness to others. And for people who may have had close contact with someone who is a confirmed patient, we ask them also to follow that guidance, and if you have symptoms, to contact your healthcare provider. Right now, there is no spread of this virus in our communities here at home. This is why our current assessment is that the immediate health risk of this new virus to the general public is low in our nation. The coming days and weeks are likely to bring more confirmed cases here and around the world, including the possibility of some person-to-person spread. But our goal of the ongoing U.S. public health response is to contain this outbreak and prevent sustained spread of the virus in our country. Now I'd like to turn over this briefing to Dr. Nancy Messonnier, who is the director of CDC's National Center for Immunization and Respiratory Diseases.
Thank you, Dr. Redfield. I want to take a few minutes and let you know what the CDC teams on the ground in Arizona, California, Illinois, and Washington State have been doing to assist the state and local public health department contact investigations. Contact investigation means tracing everyone who comes in direct contact with the confirmed case of this new virus. It's essential that we detect illness among contacts in order to make sure that if these contacts are infected, they get the best and most appropriate care, and they understand what steps they must take to prevent spreading of the illness to others. Contacts are watched for signs of illness for multiple days after the last day that they were in contact with a patient. If the contact develops a fever or respiratory symptoms, they will be tested to see if they are also infected. Right now, we have only a handful of patients with this new virus in the United States. We're conducting contact tracing for every one of those patients because we still think this strategy will allow us to contain the outbreak. I want to thank the patients here in the U.S. that have this new virus, as well as their close contacts, for their cooperation during these investigations. I also want to take a minute to thank our public health colleagues at the state and local level, as well as all the healthcare staff who have been caring for these patients. Our ability to coordinate and react this quickly is entirely dependent on those collaborations. The we here is not CDC in isolation, but our state, local, and territorial partners, as well as other federal agencies. As Dr. Redfield said, right now we think the risk to the general public in the United States is low. But risk is dependent on exposure, and while the vast majority of Americans will not have any exposure, some people will, and therefore will be at greater risk of infection. For example, healthcare workers caring for patients with confirmed infection and other close contacts. They need to be vigilant, and the people around them need to be vigilant. As the Secretary said, there is much we need to learn. Every day we learn more, and every day we assess to see if our guidance or our response can be improved. As this response evolves, CDC will continue its aggressive public health response strategy, working to protect the health and safety of the American public. I'll now turn it over to Dr. Fauci.
Thank you, Mr. Secretary. Nancy, I'm going to give you a brief snapshot of the countermeasures in the form of diagnostics, therapeutics, and vaccines that are being investigated and pursued by the NIH, by our grantees, contractors, and by our collaborators in industry. First, with regard to diagnostics, the CDC has rapidly developed a diagnostic based on the published sequence of the virus. The NIH, together with the CDC, will be working on next-generation diagnostics that are more point of care so that we can get them more distributed to people throughout the country and the world. Next is therapeutics. There is no proven therapy for coronavirus infection. Yet there are now ongoing studies that have been initiated with the previous experience we had with SARS and with MERS. For example, back then and between those outbreaks and the current one, a number of antiviral drugs have been tested in vitro, in some animal models, and even in the field, anecdotally, with historic controls. One of them is the antiviral remdesivir, which some of you may remember was used as one of the elements in the clinical trial against Ebola. And the other one that is now being used on a compassionate basis by some in China is Kaletra, which is a combination of two antiretroviral drugs. Again, I must emphasize, there's no proven efficacy of these, but they are being pursued together with the screening of a number of other agents. I might point out That is why it is so important that we get isolates of the virus, which we will soon have, both particularly from the individuals in this country who have now been infected, the 5 individuals that you've heard of. The other is monoclonal antibodies. When we were dealing with SARS, we developed monoclonal antibodies as potential therapeutics. Again, no proven therapy because they were not used. They were only used in vitro and animal models. Given the somewhat close homology between SARS and the new novel coronavirus, there could be some cross-reactivity there that could be utilized. However, what we're really trying to do, and we will have it soon, as we get specimens from individuals who are infected, that we will then be able to clone their B cells and make specific monoclonal antibodies against the novel coronavirus. And then finally, and most importantly, vaccines. We have already started at the NIH and with many of our collaborators on the developing of a vaccine. The one at the NIH that I'll just mention very briefly is in collaboration with a company called Moderna, and the platform is a messenger RNA platform. When the Chinese isolated the virus, they put on a public database the sequence. Given the technology of the 21st century, we were able to use that sequence, pull out the gene for the glycoprotein spike of the particular coronavirus, and make that the immunogen to be used in a vaccine. Right now, that's being prepared. I anticipate, with some cautious optimism, that we will be in a phase 1 trial within the next 3 months. I want to emphasize, because it's sometimes confused, going into a phase 1 trial does not mean that you have a vaccine that's ready for deployment. It will take 3 months to get into the trial, 3 months to get safety and immunogenicity data, and then you move into phase 2. What we do from that point on will be determined by what has happened with the outbreak over those months. Remember, we made a phase 1 trial with SARS, and we never had to use a vaccine. But nonetheless, we are proceeding as if we will have to deploy a vaccine. In other words, we're looking at the worst scenario, that this becomes a bigger outbreak. So in summary, there are 3 types of interventions that we're working on: diagnostics, therapeutics, and vaccines. And we will keep you posted as we make progress in each of these. Thank you.
Great. Thank you very much, Dr. Fauci, Dr. Redfield, Dr. Messonnier. At this point, we have time for questions from the media on the topic of the novel coronavirus. So, Ricardo, do you want to get us started?
Yes.
If you'll wait a second, just because of the live streaming, to get a microphone before you ask your question. Thank you.
Okay, thank you.
Yep.
Yeah, Ricardo Alonso Zaldivar with AP. And my question, could you please update us on what is known about the asymptomatic transmission? In other words, people catching it from somebody who doesn't show symptoms. And could you also tell us how long after a person is exposed does it take for the testing to pick up the virus?
Great. Let me ask Dr. Messonnier to take that.
Sure, thank you. And those are really important questions. There have been isolated reports of asymptomatic infection from several countries. Those are countries that only have a few cases, as opposed to, for example, in China, where the majority of cases are. We're looking at that data closely. It's important to know that right now in the United States, we have only 5 cases, and we have no evidence of human-to-human transmission from those cases. Those cases themselves traveled to China, and so that's an example of direct transmission from China. But that's something we're watching closely, and obviously as more information becomes available, we would have to change our operations if indeed that was a significant issue. In terms of how long it will take from the time that you're infected to develop a positive test, what I can tell you so far is that the patients that we've seen in the U.S. have tested positive, and we're following them. But the way that we're looking at close contacts is by doing more than one test, so that we can understand if, for example, we pick them up initially and they're not infected, and then later on they go on to develop disease. As many of you know, that is something we do see in other infections, where there is a period of time early where you have mild symptoms before you go on to more significant disease. The PCR tests that we have. You know, we've really rapidly turned around from having sequences available online to being able to get a PCR. It's a testament to CDC laboratorians' ability to do something really rapidly, and I'm proud of them. But as Dr. Fauci said, we're going to continue to work on other diagnostics that can also help us to understand better the spectrum of illness.
Great.
We've been watching a press conference addressing coronavirus concerns here in the city. Officials from the New York City Health Department and the Chinese American Medical Society addressing the precautions being taken in our area to keep the community safe. Globally, more than 4,500 have contracted the virus. 5 confirmed cases of coronavirus in the U.S. In China, 106 people have died from the disease. We will have more on this story on CBS and New York and CBSNewYork.com later today. Right now, we're taking a quick break, and we'll be right back.